Hey everyone, welcome to Biohack Your Body Show. I'm your host, Dr. Basima Williams. Thank you so much for listening today. Biohack Your Body is a result of my interest in longevity, specifically improving health span, those years that we're actually functional and living our best life and optimizing performance. And with me today is Dr. Mike Williams. Dr. Mike Williams is my husband, and we've been married for quite a long time. Thanks for coming to the show, Mike.
Thanks for having me. We've got an important topic to talk about as we all are
Yes.
aging.
Yes, we do. And before I get to that important topic, without our amazing sponsors, we would not be here. So I just want to do a shout out to Valvoline Express Care. Valvoline, if you want your oil changed and you're short on time, especially, they can get you in and out. You're in the bay and you're out on your way in 15 minutes. They've got several locations. And the Clarks, Mike, the Clarks used to be our patients when we were in a previous practice. And they are amazing people, can definitely stand up for their, integrity. And they absolutely love, uh, this has been something they've been doing for many, many years. So there's several locations: 724 North State Highway 47, 601 Edwardsville, 101A Kings Highway, 4504 Lee Ferry Road, 3030 Mid Rivers Drive, and 4508 South Peters Parkway. Drive in and drive out 15 minutes. Why not do that and get something that you hate doing anyway? For most people, at least I definitely do, done in
Yeah,
15 minutes. And
absolutely.
also, big shout out to myvitamin.com. Myvitamin.com makes pre-packaged supplements. They're actually made fresh when you order them, but they're pre-packaged in a sense that, like, there's a foundational pack. We give you the morning supplements and then the evening supplements, and we take out all the guesswork of what you need on a daily basis for most patients. So myvitamin.com, big shout out to them. Now, as promised, Dr. Mike, we are talking about a very timely subject. And the reason why it's so timely, and we're talking about cardiovascular disease today. The reason why it's so timely is because I was shocked when I found out that Hulk Hogan had passed away. So, of course, I, like many other people, went and looked up what happened to him. And so I found out that he had a cardiovascular event, cardiac arrest. And in most cases, that would be a heart attack. And what a lot of my patients are shocked to find out is that 365,000 out of hospital cardiac events every year happen, and 90% of them are are fatal, unfortunately. And that 50% of people actually present to your office. Oh, sorry, their presenting symptom is having an event. So obviously they're not presenting to your office, right, Mike?
Right. Yeah. Sometimes some of the statistics are somewhere like, yeah, in the 30 to 40, maybe even up to 50%. The incident where the person, the first time someone experiences some type of cardiac event, it's actually lethal. So you don't always, sometimes I think nowadays with our modern medicine and catheterizations and stents and bypass, we kind of think, oh, I'll have some chest pain and they'll catch it early and then go in and look and find something and, fix it and just put a stent in and I come home the same day. But that's not always the case in a lot of, in like over, 40 to 50% of the time.
Yeah, so that's a very important statistic, and I want to repeat it. And this is why we're having this conversation today, because maybe it can save someone's life. That 50% of people in multiple studies have found that the first detected symptom of a heart attack is the heart attack itself, which is crazy. And given that that 90% of out of hospital events have a 90% mortality rate, we, in our practice, I know you and I definitely do this. We do everything we can to find those high risk people before they have an event. Like, for example,
Right.
my brother, who was 65, we have an extensive family history. He went to his cardiologist, had a normal stress test, and was told everything was fine. And I just noticed that he was a little more tired. He would get a little more tired quickly than he normally would. No chest pain, pressure, shortness of breath. But I did insist he get something called a CT angiogram that ended up diagnosing two of his arteries almost completely occluded. And he had to have immediate stents placed. So we will talk a little bit more about that later in terms of the, testing and advanced testing and all of that stuff. But for right now, what I really want to kind of focus on is just basic things like what are the symptoms of coronary, of somebody who's at high risk. What symptoms should we be looking for and not ignoring?
Well, so symptoms, I guess your question is like symptoms of like if someone's having like an event or they're having some blockage. Is that what you
Right,
asked? Like,
like your typical
yeah,
chest pain, pressure, shortness of
yeah,
breath, nausea, vomiting.
yeah.
Yeah, all of that.
Yeah, those kind of things. Well, I mean, I think the biggest thing is when if someone is, particularly with exertion. So if, someone with some type of physical activity, they're going up the stairs or mowing the lawn, they just feel like they're more winded. They feel like a tightness of pressure, something radiating their chest, their jaw. And especially if it goes away with rest. So then you kind of sit down for a few minutes, it goes away. If it's stuff that you're used to that you normally can do, you might be a little winded because you run up the stairs and you're mowing the lawn and you get a little huffy puffy. But if it's out of proportion to what you normally have, if all of a sudden that's starting to develop and you're having to take a break where you normally don't have to, or anytime the weather's hot, your heart beats faster, you're feeling more short of breath than you normally would. Those could all be potentially symptoms. Sometimes I've had patients that their symptoms are heartburn. They feel like it's an acid reflux, but maybe it comes only on with exertion. So, it's more like when they're doing something, they're walking on the treadmill, mowing the lawn, walking upstairs, they just feel like heartburn, like they need to take a Tums or something, and they don't really feel like necessarily shortness of breath. Those can be symptoms. And so those could be maybe more atypical symptoms. And sometimes women have to be really careful with that too. Sometimes women don't always get the classic symptoms that men get. And as women are aging as a population, we're seeing more and more heart disease become prevalent in females.
That's right. What pops up in my mind, if you remember this, and I don't want to mention any names, but we had this one doctor whose dad was having chest pain, and he got on the ground and did 10 push-ups to see if his chest pain would get worse. And if it
Hmm.
did, then that would be a sign that it could be cardiovascular. And it did get worse. He did go to the hospital and he did end up having cardiovascular disease. So that's a key point. I actually had another patient who was on vacation in Florida for 3 weeks and was having increasing shortness of breath while she was there, and she assumed it was the humidity. So it's easy to just assume it's something else. And
Hmm.
unfortunately did not go away when she got back home, and we sent her immediately to the hospital when she let us know. She didn't let us know, obviously, while she was in Florida, and she
Right.
ended up having bypass surgery, 3 vessel immediately. But you know what? Had she waited, and very well could have been, if she pushed herself on that beach, she could have very well had one of those. She could have been
Hmm.
365,000 people statistic of people who die from a 90% mortality rate of having an out of hospital cardiac arrest like Hulk Hogan may have had. We are not Hulk Hogan's doctors. We are not giving any people today, medical advice. We're just giving you simple information. So just to reiterate symptoms, chest pain and also pain radiating into the jaw or left arm. Also some shortness of breath, especially the chest pain and shortness of breath worse when you are exerting yourself or exercising, and some non-specific findings, especially nausea, vomiting, or indigestion, especially if it's not associated with eating. Like Mike
Hmm.
said, if you're walking up the stairs and you're getting heartburn, that's not normal in some
Hmm.
cases. So, and then also the fatigue, lightheadedness, dizziness, heart palpitations, sometimes weird things like ringing in the ears, some symptoms, some signs we look for when we're doing an exam that everyone can look for is wrinkling in the earlobe, right?
Right. Right. There can be some association with people have like deep creases in the earlobe. There's been some association with cardiovascular disease associated with that. But again, that's a non-specific finding, so you don't want people to, just base whether or not they're healthy on earlobe creases.
No, but that is a sign that we look for when we're examining people. So we are going to take a little break. And when we get back from our break, I do want to talk about assessing your risk, what you can do right now to determine how many cardiac risk factors you are and how aggressive you want to be with testing and what kind of tests to ask your doctor for. That we'll do that as soon as we get back from this break. And if you are interested in meeting with Dr. Mike Williams or need a great primary care doctor, you can reach him at his office at ultrawellnessmedical.com or call 636 333-9820. And thank you so much for supporting Valvoline. The Clarks have supported this radio station from its inception. So thank you so much for that. Support them at all those locations that I mentioned earlier. They are amazing. You get in, get out, especially if it's a Saturday morning and that's on your to-do list. You could like have it knocked out in 15 minutes there once you're in the Bay. And thanks to our sponsor, myvitamin.com. That's myvitamin.com, professional grade supplements for your daily needs. We will be back right after this. Awesome. Good job, honey. Way to
Mhm.
go. Okay. Now our next timer is 8 minutes and 40 seconds. This is like, it just flows right out of your mouth, doesn't it?
Mhm.
You've had this conversation a few times, haven't you?
Yes.
Okay.
You need to, and I recommend vascular surgery. So your inside of your arteries are lubed up just like that Valvoline, just like you're gonna get lubed up when you take your car Valvoline. It'll be slick as snot.
Yeah, well, I don't
Okay.
know.
All
I
right.
don't know about that. Okay, you
All
ready?
right.
I have my timer
Yeah.
ready. Do you have your timer ready? 8 minutes and 40
Mhm.
seconds. Now I
Yeah.
get to use my computer again. Thank God, because that cell phone thing, it's like ringing and my timer keeps going away. All right, here we go. Here we go. We're coming back live. We're coming back hard. Okay, ready? Here we go. Hey everyone, welcome back to Biohack Your Body show. I'm your host, Dr. Basima Williams. Biohack Your Body is all things that have to do with longevity, increasing health span, and just optimizing performance and living your best life. Today I am with Dr. Mike Williams. Dr. Mike, thank you so much for being here again.
Sure. Thank you.
And we are talking about heart disease, right? I have an extensive family history, so I've really kind of dug into this a lot for many, many years. And really, because of that, I tend to really, look for it, of course, in my patients as well. So we left with some of the symptoms that you might have with coronary artery disease. Of course, that's already advanced if you're having symptoms, and also when to seek help and to get the help that you need. But now we're going to talk about assessing your risk. And I really want to go through some cardiac risk factors. And I sort of listed them according to what I feel is most important, what really brings some red flags up. And what I tell my patients is if you have three or four of these, then you really want to start looking into doing more advanced testing. That just getting your regular cholesterol, where they just check a total cholesterol, a LDL, the bad cholesterol, the HDL, the good cholesterol, and the triglycerides. When that's your full assessment of lipids, that is not enough, especially if you have a lot of cardiac risk factors. So let's go through those. My most important one, the one that really kind of raises a red flag in with my patients, is having a family history of heart disease, especially before the age of 65. And it's got to be a first degree relative, like a mom, dad,
Right.
or
Right.
a sibling, and God forbid a child, which I have not seen that yet, but you know, pretty much a sibling or your parents, basically, before
Right.
the age of 65. What are your thoughts on that?
No, I think really important. I think you can glean a lot of that. And, sometimes too, even going back, to the grandparents and stuff. I mean, again, if there's a really strong family history where you're seeing it in the family, people are dying at early ages, 50s, 60s, having heart disease, having bypass, heart attacks. It's just kind of a clue, probably more on the cholesterol side, but it is a clue that there's something genetic going on that, that this person, you're probably at a little bit higher risk of heart disease, of vascular disease. So it's another little metric we use to kind of point the needle one direction. How aggressive do we need to be in trying to, take care of all the risk factors that may be present.
That's right. And then the next risk factor that I have that I think is really important is people who smoke, because
Right.
it's so toxic to the arteries.
Yeah. That's probably one of the biggest ones. I would say, when I see people that have vascular disease, probably some of the worst vascular disease. I mean, diabetics, which we haven't got to yet, but obviously diabetes is really tough on the vessels. But smoking is without question one of the things that you always see, definitely increases an individual's risk for, you know, heart disease, but also vascular disease, stroke, blockage in the arteries, blockage in. I have, other than a diabetic, I don't know that I have ever seen in my years of practice a patient with really bad vascular disease in their legs that didn't smoke. It's just pretty rare that that's the case. So
So
smoking is
I
just
just
really
I
tough
just
on
want
the
to be
vascular
clear.
system.
Yeah, I want to be clear with what you're saying. What you're saying is diabetics and tobacco use are the ones that have that peripheral
Probably some of the
heart
worst.
disease.
Yeah,
Yeah, I
absolutely.
agree. Yeah, totally. And I would say that combination is really bad, but also independently, they tend to be bad as well. So
Yeah.
yeah, if you smoke, you got to quit. It's like, it's not sexy anymore. Just get rid of the
And
tobacco.
and
And
there's no amount that's okay. It's
right.
not okay to kind of be a social smoker or something like that. I mean, it's still causing a lot of damage to the vascular
Exactly.
system.
And there's a lot of help. So get that help from your doctor to help you quit smoking. And there's a lot of books written on it in terms of setting your mindset and things like that. Definitely something you want to do. The next thing, of course, is being diabetic and having the high blood sugars. And we've talked in previous shows how glucose outside of a cell can actually be extremely toxic and extremely
Mhm.
pro-inflammatory. It's one of the most inflammatory things that you do on a regular basis. So definitely having your blood sugars controlled, even as a diabetic. So just being a diabetic puts you at risk, but if you can control your blood sugars, it will certainly help decrease that systemic
Yeah,
inflammation,
absolutely.
yeah, which is what causes the progression of the coronary artery disease.
Right.
And then lipids. With lipids, I kind of break it down into three big sections, and I'd be interested to hear what you say. But I basically break it down into three separate risk factors: having a low good cholesterol, which is the HDL, having a high ApoB, which is a total of all of your bad LDLs, and then independently having a high LP little a, which is a form of LDL that's particularly atherogenic. So, what are your thoughts on that? Do you agree with that?
Yeah, I agree with that. And I think probably putting even more emphasis now on, the LDL uh, um, and lipoprotein little a and the ApoB, those markers those are the bad cholesterol. So basically bad cholesterol, we know that that's when those levels are high, definitely individuals are higher risk for vascular disease, independent of other risk factors. So if you just screen people, you took a group of people that have like really good levels just genetically, maybe through diet, genetics. You have a group that has really high levels, they're going to have more incidence of vascular disease, heart attack, strokes.
That's right. And then another risk factor is high blood pressure. Even if
Mhm.
it's controlled, the fact that you even have high blood pressure is a red flag, but definitely control it because we don't
Mhm.
want you to have a stroke or anything else like that. But having high blood pressure is another risk factor. And then age. For men, it's greater than 45, and for women, it's greater than 55. Now, we just went through family history, tobacco use, diabetes, lipids, which is like three cardiac risk factors, low good cholesterol, high bad cholesterol, and then a high LP little a, and then high blood pressure and your age. Now, if you've got like three or four of those, that's a big red flag. So
Mhm.
you already want to be talking to your doctor about prevention. The other things, sedentary lifestyle, obesity, your diet, a pro-inflammatory diet,
Mhm.
drugs, high inflammation with homocysteine. The homocysteine level is an independent cardiac risk factor as well. And, even EMF exposure. So all
Mhm.
these things,
Well,
menopause.
and also people that have like autoimmune conditions, rheumatologic conditions, psoriatic arthritis,
Mhm.
lupus have higher incidence,
Yep.
chronic kidney disease.
Yeah.
Yeah.
Heal the gut. That's what we talk about when one of our other shows is on healing the gut. This is why we want to focus on healing the gut because it really does reduce systemic inflammation as well as it helps some of those autoimmune diseases. And one other thing I just wanted to touch on too, for women over the age of 55, this is because they no longer have the protective effect of estrogen. This is why going on hormone replacement therapy, in most cases, if your doctor agrees that you should be on hormone replacement therapy, do not be afraid of it as long as you don't have contraindications for it. Talk to your doctor about that because estrogen is protective. I always say estrogen helps protect against cognitive dysfunction, bone disease, and heart disease. And guess what? All three of those things are invisible until they happen to you. And then you only wish. I can't tell you the number of people in my practice that wish they would have been on hormone replacement therapy when they're looking at their bone density report and it's a minus 35% in their hip and they're high risk for fracture. So, all right, we have to take a little break. We will be right back with, hey, Mike, what do you do in your office to help diagnose these people at an early time? So we'll be right back after these messages. Good job, Dr. Mike. Okay, now we do 13 minutes and 40 seconds.
Okay.
On your mark, get set, and go. Hey everyone, welcome back to Biohack Your Body Show. I'm your host, Dr. Basima Williams. Biohack Your Body is a result of my love and interest in longevity, improving health span, all things in improving performance, and just living your best life for as long as you can while you're gifted with these years on this earth. Now, we have been talking to Dr. Mike Williams, and many of you guys might not know this. But Dr. Mike works at Ultra Wellness Medical. You can find him at ultrawellnessmedical.com. And you can also call 636-333-9820. That's 636-333-9820. Now, what you guys might not know about Mike, other than the fact that he's my husband, is while we were in medical school, this guy scored 100% in cardiology, which there was a high failure rate. So while everyone else was getting a C, Mike was getting 100% on everything. And I'm like, how the heck are you doing that? Now, I didn't get a C, I got a B in cardio, which I was very proud of. And then I found out you had 100%, not a 98%, but you had 100%. That kind of, so I think you're a good person to talk to about all things cardiovascular. For some reason, it just seems to come really natural to you, right?
Mhm. Right, right, right. I always had an interest in cardio. I like cardiology.
Yeah, I'm kind of shocked you didn't go
Just
into
good.
cardiology. Why didn't you go into cardiology? You'd have been amazing.
Because they have to work too hard. They have to work hard.
So you quality of life. They are stressed out all the
They
time.
get caught.
Those
They're stressed out. They have a lot of heart attacks.
they do. And you know what? They are always ready. They're on the go. Those cardiologists, thank your cardiologist. If you see one, they work really hard, you guys. I mean, I've been in so many emergency room situations where when the cardiologist finally walks in, I'm like, oh, thank God, because now the patient can go to the back on a gurney and get cathed and get whatever other life-saving mechanisms and treatments they need. So thank God for them. And it is very stressful. But let's talk about keeping people off that gurney, keeping people off the ER, out of the ER, because that's what we do really well. And one of the things we do is one is we take a really good history in terms of assessing who's at highest risk. We also educate our patients with, if you're having these symptoms, don't ignore them. At the very least, ask us. At the very least, send us a portal message or something. But now we're talking about assessment. So the first thing I do on all my patients is I do something called an advanced lipid assessment. So that does the four cholesterol numbers, which everyone knows about, the good cholesterol, the bad, the total, and the triglycerides, which, by the way, triglycerides are really important and an indirect marker of how well you're doing with your blood sugar regulation. I just had a patient recently tell me the only time his triglycerides have ever been normal is when he doesn't drink more than 10 drinks a week. And I'm like, that's because your blood sugars are going up and it's affecting your
All the
liver.
carbs.
So yeah, lots of carbs. So that's an indirect marker. But one thing that I see that a lot of my patients don't have is unfortunately the fractionated lipid particles, the ApoB, the LP little a. Those are very important numbers. Can you go into a little detail on an advanced lipid assessment, please?
Well, we always look at, and all the studies are done on really looking at LDL. So those base numbers. So always look at LDL. And that's where a lot of the data has come from when it looks at like what should someone's LDL, their bad cholesterol be, particularly when we're treating them. And so we have data on that when we look at putting someone on medicine. We try to treat to a certain level if they have heart disease, because we know that if we do that, it can lessen or decrease the risk of further vascular progression and interventions that will be needed later on. But beyond that, there's a lot of other markers, and some of those you mentioned are the ApoB, which is really it's another marker. It's kind of the atherogenic or the bad actors, but a little bit more in detail than the LDL. So it includes the LDL, the bad cholesterol, plus VLDL, triglycerides, kind of the forms of cholesterol, these lipoproteins that carry around cholesterol in your vascular system, that can get taken up by the lining of the arteries and start to cause plaques and these blockages that can develop. And so it's a little bit better marker for us to look at because sometimes the LDL may not be that may not look that bad, but the ApoB is a lot higher, and so we might be a little more concerned and be more more aggressive in treating if that's high. The other one is lipoprotein little a, and so lipoprotein little a is one that it's a genetic marker. It's a marker that tends to carry bad, more oxidized or kind of bad cholesterol. It's a form of LDL that some people are born with it. So some people that have high levels versus good levels, it's just another metric that we use because if it's high, it increases your risk, lifetime risk of having a heart attack or stroke. So it doesn't mean someone's a heart attack waiting to happen if it's high, but we like to assess that because we like to look at it in the context of a lot of things. Their cholesterol, maybe their cholesterol is borderline. It's just a little bit high. It's not super high, but it's a little bit high. They don't have a lot of the risk factors, but say some of these other markers that we're looking at are high, then it might indicate that, maybe we need to be more aggressive with lifestyle and with maybe in certain situations, cholesterol medication or different supplements to try to decrease the risk. Because our goal is to decrease your risk over the next 10, 20 years.
Okay, so ApoB is a reflection of the number of potentially harmful particles in total of your LDL. So just an LDL, just those four numbers, the LDL by itself is not enough. That's the bottom line. ApoB is a better indicator. And then
Mhm.
of that, LP little a, Mike, you alluded to it, it is a genetically predisposing LDL type. So LP little a lot of times we can't really do anything with, not even with prescription medications. Although I have
Mm.
seen that lifestyle medicine has decreased that number. Now, let's go through some other things that we should be assessing if we're really taking this on and super serious. Now, the other thing you should assess is your blood sugars, right? So with a hemoglobin
Right.
A1C and fasting blood sugar, but also, can you talk a minute about continuous glucose monitor and how they're really revolutionizing how people are assessing their blood sugars and how food is affecting their bodies in real time?
Well, obviously when someone becomes diabetic, they don't go from being one day not diabetic to diabetic. It's a transition and people have a metabolic process where their sugars are starting to creep up. And so that's where a continuous glucose monitor can be beneficial because it can really give people real time. It's giving you your sugar continuously, and you can really see how certain foods or the types of foods or activities, stress will affect that. And so oftentimes you could think you're eating something really healthy. You could think, okay, I'm eating this orange and it's really healthy for me and it's good. And it's actually shooting your sugar 40 points and you don't even realize it. So you realize that maybe, you need to exercise after dinner and that drops your sugar. So those are all things that it's just more tools in the toolbox to give people better information on how to eat and keep their sugars down and prevent a lot of spikes.
Yeah, I actually did a course on nutrition at yourthrivecode.com. Nutrition, it's only $47. We made it available to everyone at that price. And we did a whole bunch of experiments with the continuous glucose monitor. For people who don't know what it is, it's a little tiny monitor. It's about the size of a quarter that you inject into the back of your arm. If you go to Doctors, spell that out, Doctors, Being, functional, Doctors Being Functional, Instagram. And I actually made a video on how to apply a continuous glucose monitor on the back of your arm. I did that so that people don't waste them because they're about $75 each if you're having to pay cash, but your insurance may actually pay for it, especially if you are diabetic. And in some cases, even if you're just trying to lose weight or on high risk medications like Ozempic and things like that. Now, if you are monitoring your blood sugar, there's a whole bunch of variations, right? If you eat at night versus if you eat in the morning, if you eat your vegetables first
Right.
and then you eat your sweet potato, if you eat a sweet potato by itself, if you eat a bag of chips, you want to know what's happening to your blood sugars because one of the biggest indicators of disease is your blood sugar shooting up, right?
Right.
The
Well,
other,
absolutely.
oh, go ahead.
No, no, absolutely. Yeah, it's those sugar spikes and then obviously what your fasting sugar is in the morning, how does your body react to it? can it process that sugar and keep the levels down, or do you start getting what we call glucose intolerance or resistance to insulin, where all of a sudden your sugars start to just creep up and they become higher than what they should be on an average basis. So they kind of just reset to a higher level, which is not good.
Yeah. And I also check something called a fasting insulin level, a leptin level, and something called a HOMA IR. These are all what I would consider sort of the pre-diabetic markers. And in a fasting state, you want your insulin to be super low. Remember, insulin is a growth hormone. You don't want a lot of it all the time. So after a overnight fast, you want your insulin to be low. And so
Mhm.
it's important to get those numbers. Now, the other thing, of course, everyone should have are some major inflammatory markers like your homocysteine level, fibrinogen, a CRP, though that's less reliable because that's going to be a little bit higher after a, hard workout. I do hit workouts 3 days a week. If I get my CRP the next day, it may be elevated because it should be because I caused some local trauma to the muscles. But definitely the homocysteine and fibrinogen are indirect inflammatory markers that are also potentially markers for coronary artery disease. Now, everyone should get a baseline EKG, right? That's pretty basic. But what do you think about a CT coronary calcium score? Now, the way I do it is if you've got 3 or 4 cardiac risk factors, and especially if they're the big ones, the family history, the hyperlipidemia,
Right.
the bad cholesterol, and especially if you have high bad cholesterol and low good cholesterol, you're getting a CT coronary calcium score test. What do you think about that?
I think good. I think I have a low threshold to get those, but again, I think if you have someone that's super healthy, no risk factors, they're exercising, probably it's pretty low yield to get it. But the nice thing about that is with people with with risk factors, particularly if they're over 45 or in their 40s, 50, it's a really inexpensive test that doesn't require any dye. It takes about 2 minutes to do. You're not in a big tube. It's not a really tight tube, but and the thing is, it's not covered by insurance, but it's very inexpensive. It's like in the $130, $140 to get
Yeah.
it done. And it also gives some other information. It tells us a little bit about, potentially some early heart disease plaquing. It's not giving us a 3D look through your arteries to tell us how much, but it's giving us an idea. Is there a process going on? So we kind of know the cat's out of the bag, so to speak.
Yeah.
But also it's getting some shots of your lungs and your vessels so we can also see, I have a patient who we picked up an aneurysm, a dilation of his aorta he didn't know about, asymptomatic. He didn't require surgery. We just need to monitor it because if it grows too fast, he's going to have something done. But so there's a lot of good data with that. So I have a low threshold on patients to get
Yeah,
that.
I agree. For 150, I say $150 cash pay, ask your doctors for it. Hopefully you have a doctor who is thinking outside of the box and will actually order a CT coronary calcium score. We have Excel imaging that does ours on a regular basis. You do have to have a doctor's order though, because the results have to go somewhere to someone who knows how to, manage them. And we only have a minute left, but I would love your thoughts on CT coronary cardiac angiogram. Can you just kind of tell us what that is? And
So the
I
so
know
the
recently you had a patient who had a negative stress test, but it had a CT coronary calcium score that was high, and you went ahead and did the CT coronary angiogram. And Mike, I'm really sorry, but we're almost out of time for this segment.
yeah.
But we're going to get back to that patient and what your thoughts are on a CT coronary cardiac angiogram right after these messages. But again, if you want to contact Dr. Mike, you have concerns, you have a doctor that's not doing all this for you, and you want a second opinion, ultrawellnessmedical.com. That's ultrawellnessmedical.com or call 636-333-9820, and we'll be back right after this. Boom. Got one more left. Ready? 10 minutes and 30 seconds.
Yes.
Sorry, I had to cut you off.
Okay.
There's no way you're going to be done. 10 minutes and 30 seconds. So the 30, it goes down to 30. Ready?
Mm.
Hey everyone, welcome back to Biohack Your Body. Where Dr. Mike and I are in a deep discussion on coronary artery disease, just what you want to spend your Saturday and Sunday talking about. But you know what? I hope that this saves people's lives, and I hope everyone wakes up to realize, oh my gosh, I've got all these risk factors. If you haven't heard the whole show and you're interested in assessing your own risk and being your own health advocate for your cardiovascular disease, listen to this whole show. You know, write down the cardiac risk factors that you might have, write down some testing that you might want to do, become familiar and know what symptoms are associated with having a heart attack. Because if you have a heart attack outside of the office, which 50% of people who have their first detected symptom is a heart attack outside of the office, you have a 90% mortality rate. So with that in mind, Mike, this is why a CT coronary cardiac angiogram is so important for some people. And I left off with a patient that we had been talking about not that long ago, where the patient had a normal stress test, but had a high coronary calcium score. And I believe between the patient and you guys decided to get the CT coronary angiogram, which
Mhm.
unfortunately in some cases is not covered by insurance, a little bit more involved because it does require an IV with a little contrast. But we do get a 3D image of the blood vessels, which is amazing technology. We're even using AI for interpretation now of it. And the cost is generally about $1,500 if insurance doesn't pay for it. But man, that's a lot better than having a heart attack. So tell us about this
Right.
patient and tell us what a CT coronary calcium, I mean,
So
sorry.
the CT angiogram, really what that's doing, it's giving us a little bit better picture of the arteries themselves. So the calcium score just tells us, has there been some inflammation in the vascular system? And anytime there's inflammation going on, which might be the indication of some plaquing or disease, your body will lay calcium down. So we can measure density and we can base on that say, yeah, it looks like you've got some pretty significant or mild disease going on. But the CT angiogram is really give us an idea, a look at the vessel, how much blockage is there is the vessel. And it's not a precise, it's not like 50%, 55% blocked, that type of percentage, but it gives us an idea like a range, like, 25 to 49% or 40 or 50% to 74% or something like that. And what we really worry about is, we're more concerned when we start having like really stenotic lesions, tight lesions, excuse me, narrowing, where it's starting to get like 70% or higher. So it really helps us to delineate because the problem is, yeah, a stress test, as many people may or may not know, you're on a treadmill, you're walking fast, you're getting your heart rate up. They're taking some pictures, but it's a screening test. It's not giving us like an actual look at the arteries themselves. So that's what's nice about the CT angiogram is that, using the CT scan, some dye, they give you a little nitroglycerin, some medication to slow your heart rate down. They can actually get a picture and we can get a sense like how bad is the disease? Is it something we really need to worry about? Is there a little bit of blockage? So we just need to be super aggressive on a medical side to prevent further blockage, or is it something that we need to have further intervention? We need to get you with a cardiologist because the gold standard is the cardiac cath, where they're actually going up and and squirting dye and looking to see how much blockage is there, where they can also do interventions like ballooning and stenting to open those lesions up. So it's another tool. It's a nice tool that's somewhat non-invasive compared to, a cath where they go into your groin and puncture an artery and look and squirt dye and look at things. Um, that can really kind of help us to decide, like, what's the next step? This person needs a lot more advanced help with a cardiologist, or we just need to really, really tighten the diet and medications to prevent further blockage and progression of disease.
That's right. It really does help dictate treatment. And that's one of the
Mhm.
biggest reasons why I liked getting that CT calcium score, I mean, the calcium coronary test score, because it kind of helps me know how aggressive to treat this person who may be sort of on a borderline with their lipids and really tightening up that diet is a really good idea. Doing all of that stuff anyway, but definitely if you have multiple cardiac risk factors, especially if you have a little calcium in the arteries already, things like that, definitely very important. In fact, when the patient from Florida was having the shortness of breath, she actually had a CT coronary angiogram, and insurance paid for it because she was symptomatic. But my brother was not symptomatic, and so he had to pay for it himself. But both of those tests were positive, and both of them were life-saving. It's the same test. One insurance paid for it, one didn't. But in both cases, the end result is that somebody who's still alive right now. That's
Mhm.
the most important thing, and that's really why we're doing this show today. So, other than that, other than early detection, assessing your cardiac risk factors, early detection tools like the CT coronary calcium score or the angiogram, what other recommendations do you have? And I want to start with diet. I generally recommend a Mediterranean diet. I always say eat the rainbow of foods. fish, poultry, olive oil, little avocados, some berries. But the idea here is get rid of the processed foods that have the bad for you oils, like munching on sunflower seeds that are processed and fried and, and have a whole bunch of seasonings that are really kind of inflammatory, or eating a bunch of cookies or potato chips, and really you want to eat the whole foods. You want to get rid of anything that's in a box or a bag, is what I tell
Mhm.
my patients. Most
Right.
of the time you don't need to be perfect, but most of the time. What do you think about that?
Right. No, I think I agree. That's really, there's lots of diets, and when you look at the data, kind of the Mediterranean diet, that's the diet that really has the best outcomes when it comes to cardiovascular disease, stroke, hypertension, diabetes. And it's a diet based on the what they call the blue zones, the places where people live to be 100 and they're really healthy and active, and there's less heart disease. Those are the kind of diets that they follow.
Right.
So
And
that's
then
where that comes.
that's right, monitoring your blood sugars, and that's where that continuous glucose monitor comes in. And if you're really unclear about what to eat, how to eat, when to eat, how much protein to eat, what types of fats to eat, go to yourthrivecode.com and buy the nutrition module pillar, because we also have 3 lectures on blood sugar regulation, continuous glucose monitoring. And a lot of people wear these continuous glucose monitors and have no idea what to do with the information.
Right.
We
Yeah, it's
need to,
complex.
yeah, we need to empower our patients. The other thing is supplements. And one of the most important supplements that I put just about every single one of my patients on from myvitamin.com is a foundational omega-3. So definitely, I want a good, super clean omega-3, not the ones that smell fishy or that give you that heartburn, fishy taste in your mouth, but one that's super clean. Myvitamin.com foundational packs, myvitamin.com with no S, myvitamin.com. They have a foundational pack for women, men, women over 50, and for our teenagers and college kids. They're not eating great. This certainly would help. So that, and then also a couple other medications, statin drugs, and another drug that I use frequently called Zadia. When I use a statin drug, I always combine that with CoQ10, because when you use a statin drug, you are going to stop making CoQ10 like you used to. So then you're going to get the achy muscle pains and feel tired, because CoQ10 is vital for making energy. It's a mitochondrial cofactor that's essential for making energy. And if you don't have it, you're not going to make as much ATP. So you're going to be more tired if you're taking statin and not also taking CoQ10 with it. So really important to do that. What are your thoughts on that?
No, I agree. Not all people, statins are still kind of our first line medication. There's other medicines that we use, but they have the most data, and most people do well. They kind of get a bad rap at times, because of some muscle achiness, but most studies, people do well with them. There's a small percentage of people that can have that. And again, just talk to your doctor and work through that, you know,
That's
to
right.
try
Talk to
to
your
find
doctor
something
about it.
that'll work for you.
That's right. Talk to your
But don't
doctor.
just not take. I think the key point is just don't not treat it. Don't let cholesterol. Don't be okay with the fact that it's just because your cholesterol's high, it's okay and not to treat it.
Yeah.
But
One
obviously,
of
lifestyle
our
and diet are the foundations.
One of our pastors used to say, ignorance is not bliss. Not knowing and or just ignoring it is not a
Mhm.
good idea. And then, of course, exercise, eating a lot of antioxidants, whole foods, healthy fats, all that stuff, and medications when needed, treating the blood pressure, treating the blood sugars, all of that definitely is significantly lowering your risk for having a heart event. Any closing thoughts, Dr. Mike?
No, I think just people have a lot of data today. We have a lot more tools, blood pressure machines, or rings that help track your sleep, whether you're sleeping well. That's an important factor as well. Blood continuous glucose monitors, check your blood sugar. So people just need to be, use the data that they have, be advocates for themselves. Don't just rely on a medication, or just their doctor to kind of tell them that things are okay. Do be more of a patient advocate and work hard for yourself.
Yeah, be your own patient advocate, you guys. And if you need help with that, go to ultrawellnessmedical.com, 636-333-9820. And thank you, Dr. Mike, and thank you everyone for listening. And we really look forward to seeing and talking and having the show next week. Bye, everyone. Good job, honey. All right. I'm gonna